My name is Dr. Hyman, and I'm a board-certified plastic surgeon here in New York City. So breast augmentation is a procedure that makes the breasts larger. There's a couple different ways to achieve that these days. Primarily, breast implants are the most reliable, reproducible way to do it. But there are some women who prefer fat grafting to the breasts, which actually has become quite common. Unfortunately, fat grafting to the breasts is less reliable, and we certainly can't achieve the sizes that we can with breast implants. The silicone breast implants are definitely more natural looking and feeling than the saline implants. The saline implants typically give a much less natural look and feel. Surgeons tend to overfill the saline implants, making them very round and very hard. And that is a specific look that some people are really trying to achieve. But in my practice, I prefer the more natural, longer lasting, and what I consider even safer implants, which are the silicone implants. It is common for patients to have mastopexy or breast lift in conjunction with breast augmentation. Breast augmentation takes approximately an hour and a half. Sometimes if a mastopexy is involved, it can add 2 or 3 hours of time. A breast augmentation with a lift is a much longer procedure than a breast augmentation alone. Generally, a patient after breast augmentation should expect to take 2 weeks off from work and 4 weeks off from exercise. This varies depending on what your job is, as well as what your exercise routine is. Patients can see the results immediately after breast augmentation. Typically 1 month is when I tell people to expect a nice looking result, although there is still some swelling. I'd say 1 month to 2 months is when you could expect final results. Breast augmentation is a relatively safe procedure. There are risks to any surgery, bleeding, infection, capsular contracture, but they are quite rare with breast augmentation these days. The breast implant is under the muscle, and in terms of feeling the implant, for the most part, you feel natural breast and muscle, and the implant is deep. I usually tell patients that are interested in breast augmentation that it is a very safe and effective procedure. It's important to understand the nuances of the procedure and to get the right size. I'm 100% available for the patients. They can text me directly or call the office and be put through immediately.